121. A nurse is caring for a patient with lung cancer who is receiving chemotherapy. What is the most important nursing action to manage the patient's risk for infection? A. Monitor for signs of infection. B. Administer antibiotics prophylactically. C. Encourage the patient to ambulate frequently. D. Provide a high-protein diet. Answer: A. Monitor for signs of infection. Rationale: patients undergoing chemotherapy have suppressed immune systems, making them more vulnerable to infections. Monitoring for signs of infection is critical for early intervention. Antibiotics may be given as needed, but preventive antibiotics are not routinely administered. Ambulation and diet are supportive, but do not address the immediate infection risk. 122. A nurse is providing care to a patient who has undergone a radical prostatectomy. What should the nurse prioritize in post-operative care? A. Monitor for signs of infection. B. Encourage the patient to drink large amounts of fluids. C. Teach the patient how to perform Kegel exercises. D. Apply ice to the surgical site. Answer: A. Monitor for signs of infection. Rationale: after a prostatectomy, infection is a significant concern. Monitoring for signs of infection such as fever, redness, and drainage is a priority. Fluid intake is important, but infection risk takes precedence. Kegel exercises can be taught later in recovery, and ice may be used, but infection monitoring is the most urgent. 123. A nurse is caring for a patient who is receiving chemotherapy for leukemia. Which of the following interventions should be included to reduce the risk of bleeding? A. Encourage deep breathing exercises. B. Administer platelet transfusions as prescribed. C. Offer high-fiber foods to prevent constipation. D. Teach the patient to avoid physical activity. Answer: B. Administer platelet transfusions as prescribed. Rationale: chemotherapy can cause thrombocytopenia, low platelet count, increasing the risk of bleeding. Administering platelet transfusions is the most direct intervention to manage this risk. Deep breathing, high-fiber foods, and avoiding physical activity may help overall wellness, but are not direct interventions for bleeding risk. 124. A nurse is providing care for a patient receiving radiation therapy for esophageal cancer. What is the most important nursing intervention? A. Monitor for esophagitis. B. Encourage frequent oral hygiene. C. Ensure the patient receives a high-protein diet. D. Administer antiemetics regularly. Answer: A. Monitor for esophagitis. Rationale: radiation therapy to the esophagus can lead to esophagitis, causing pain and difficulty swallowing. Monitoring for this complication and intervening early, such as with pain management, is a priority. While good oral hygiene, a high-protein diet, and antiemetics are also important, they are not as critical as addressing esophagitis. 125. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. Which of the following interventions should be prioritized to manage the patient's risk of neutropenia? A. Administer colony-stimulating factors as prescribed. B. Encourage hand-washing and hygiene. C. Provide a low-fat, low-sugar diet. D. Monitor for signs of fluid overload. Answer: A. Administer colony-stimulating factors as prescribed. Rationale: neutropenia is a common side effect of chemotherapy, which can increase the risk of infection. Colony-stimulating factors help stimulate the production of neutrophils, a type of white blood cell, reducing the risk of infection. Hand-washing and hygiene are also important, but secondary to the administration of medications to boost neutrophil count. Diet and monitoring for fluid overload are not directly related to managing neutropenia. 126. A nurse is caring for a patient who has undergone a colon resection for cancer. The patient is experiencing signs of dehydration. What is the most appropriate nursing intervention? A. Administer intravenous fluids as prescribed. B. Offer electrolyte-rich fluids. C. Encourage high-fiber foods. D. Initiate nasogastric tube feeding. Answer: A. Administer intravenous fluids as prescribed. Rationale: dehydration after surgery is a critical concern. Administering intravenous fluids is the quickest and most effective way to rehydrate the patient. Electrolyte-rich fluids and nasogastric tube feeding are supportive, but not as immediate as for fluids. High-fiber foods may be helpful later in recovery, but are not suitable for a patient who is dehydrated. 127. A nurse is caring for a patient with a history of breast cancer who is receiving tamoxifen therapy. What side effects should the nurse monitor for? A. Hot flashes. B. Weight loss. C. Constipation. D. Decreased appetite. Answer: A. Hot flashes. Rationale: tamoxifen, a selective estrogen receptor modulator used in breast cancer treatment, commonly causes hot flashes. While weight loss, constipation, and decreased appetite can occur, hot flashes are the most common side effect of tamoxifen therapy. 128. A nurse is caring for a patient with pancreatic cancer who is experiencing nausea and vomiting due to chemotherapy. What is the most important intervention? A. Administer antiemetic medications as prescribed. B. Encourage the patient to drink ginger tea. C. Monitor the patient for dehydration. D. Offer small, frequent meals. Answer: A. Administer antiemetic medications as prescribed. Rationale: chemotherapy-induced nausea and vomiting can be severe, and administering antiemetics as prescribed is the most effective way to control this symptom. Ginger tea, hydration, and small meals may help, but they are secondary to pharmaceutical management of nausea. 129. A nurse is caring for a patient with cancer who is experiencing extreme fatigue. Which of the following actions should the nurse prioritize? A. Encourage a daily exercise routine. B. Provide frequent rest periods. C. Offer a high-protein diet. D. Increase the patient's fluid intake. Answer: B. Provide frequent rest periods. Rationale: fatigue is a common symptom of cancer and its treatments. Frequent rest periods help conserve energy and reduce exhaustion. While exercise and diet are important, they should be tailored to the patient's energy level. Increased fluid intake is also helpful, but secondary to managing fatigue. 130. A nurse is caring for a patient undergoing chemotherapy for breast cancer. The nurse observes that the patient has developed mouth sores. Which intervention should the nurse implement? A. Recommend a soft, bland diet. B. Instruct the patient to gargle with mouthwash containing alcohol. C. Advise the patient to brush their teeth aggressively. D. Encourage the patient to stop chemotherapy. Answer: A. Recommend a soft, bland diet. Rationale: mouth sores, mucositis, are a common side effect of chemotherapy. A soft, bland diet will reduce irritation. Alcohol-based mouthwashes and aggressive brushing can worsen the sores. Stopping chemotherapy may not be appropriate unless advised by the oncologist. 131. A nurse is teaching a patient about radiation therapy for cervical cancer. Which statement indicates that the patient understands the teaching? A. I will need to avoid all foods during treatment. B. I can expect my skin to become irritated in the treated area. C. Radiation therapy will make me feel better right away. D. I will need to stay in the hospital during treatment. Answer: B. I can expect my skin to become irritated in the treated area. Rationale: skin irritation is a common side effect of radiation therapy. It is important for the patient to be informed about this and how to manage it. Avoiding all foods and expecting immediate relief are not typical expectations. Hospitalization is not usually required for radiation therapy. 132. A nurse is caring for a patient with lung cancer who is receiving chemotherapy. The nurse notices that the patient is experiencing shortness of breath and a cough. What should the nurse do first? A. Administer oxygen as prescribed. B. Increase the rate of the 4 fluids. C. Check the patient's blood pressure. D. Notify the healthcare provider. Answer: A. Administer oxygen as prescribed. Rationale: shortness of breath and cough could indicate respiratory distress, and administering oxygen helps alleviate symptoms while further assessment is done. The other interventions are less immediate in addressing the patient's respiratory needs. 133. A patient with colorectal cancer is receiving chemotherapy and reports experiencing nausea and vomiting. Which of the following is the most appropriate intervention to manage these symptoms? A. Administer antiemetic medications as prescribed. B. Increase the patient's fluid intake. C. Offer the patient small, frequent meals. D. Encourage the patient to rest in a sitting position. Answer: A. Administer antiemetic medications as prescribed. Rationale: antiemetics are the most effective way to control chemotherapy-induced nausea and vomiting. Increasing fluid intake and offering small meals can help but are secondary to pharmacological intervention. Resting in a sitting position may be helpful for comfort, but does not address the underlying issue. 134. A nurse is caring for a patient with metastatic cancer who is receiving opioid pain medication. Which of the following interventions should be included in the care plan? A. Administer opioids on a fixed schedule. B. Limit the patient's fluid intake. C. Monitor the patient's blood sugar levels. D. Avoid offering pain medications if the patient requests them. Answer: A. Administer opioids on a fixed schedule. Rationale: pain management should be proactive, especially in cancer patients, to prevent pain from becoming severe. Administering opioids on a fixed schedule ensures effective pain control. Monitoring blood sugar levels is not typically necessary unless the patient has diabetes. Limiting fluids or avoiding pain medications are not appropriate in this case. 135. A nurse is providing education to a patient about the side effects of chemotherapy. Which of the following should the nurse include in the teaching? A. You may experience hair loss. B. Chemotherapy will improve your skin condition. C. Chemotherapy will not affect your appetite. D. You will not feel tired during chemotherapy. Answer: A. You may experience hair loss. Rationale: hair loss is a common side effect of chemotherapy. Educating the patient about potential side effects such as hair loss prepares them for the changes they may experience. Chemotherapy typically causes fatigue, loss of appetite, and other side effects, not improvements in skin or energy. 136. A nurse is caring for a patient who is receiving radiation therapy for head and neck cancer. What is the most important nursing intervention? A. Provide oral care before and after treatments. B. Encourage the patient to chew gum frequently. C. Offer ice chips to soothe the mouth. D. Apply moisturizing lotion to the skin. Answer: A. Provide oral care before and after treatments. Rationale: radiation therapy to the head and neck can cause mouth dryness, sores, and mucositis. Good oral hygiene is essential to minimize these effects and promote healing. Chewing gum and ice chips may help but are secondary to proper oral care. Moisturizing lotion is important for skin care but does not address the oral side effects directly. 137. A nurse is caring for a patient receiving chemotherapy for cancer. The patient is at risk for neutropenia. Which of the following is a priority intervention? A. Instruct the patient to avoid crowded places. B. Provide a high-protein, high-calorie diet. C. Encourage fluid intake. D. Administer prescribed antibiotics. Answer: A. Instruct the patient to avoid crowded places. Rationale: neutropenia increases the risk of infection, and avoiding crowded places helps reduce the likelihood of exposure to infectious agents. A high-protein diet supports healing, but is secondary to infection prevention. Fluid intake and antibiotics may also be part of the care plan, but are not as immediate in preventing infection. 138. A nurse is caring for a patient receiving chemotherapy for lung cancer. The patient is experiencing nausea and vomiting. Which intervention should the nurse prioritize? A. Administer antiemetics as prescribed. B. Provide a high-calorie diet. C. Offer fluids with a high sugar content. D. Encourage the patient to rest in bed. Answer: A. Administer antiemetics as prescribed. Rationale: antiemetics are the most effective way to manage chemotherapy-induced nausea and vomiting. Offering fluids with sugar or a high-calorie diet may help later, but are secondary to managing the nausea. Resting in bed may offer comfort, but does not address the root cause of nausea. 139. A nurse is caring for a patient with ovarian cancer who is receiving chemotherapy. Which of the following side effects should the nurse monitor for? A. Hair loss. B. Excessive weight gain. C. Decreased heart rate. D. Increased appetite. Answer: A. Hair loss. Rationale: hair loss is a common side effect of chemotherapy. Monitoring for hair loss and providing support to manage it is important. Weight gain, decreased heart rate, and increased appetite are not typically related to chemotherapy for ovarian cancer. 140. A nurse is caring for a patient receiving radiation therapy for rectal cancer. What is the most important nursing action to minimize skin irritation from radiation? A. Apply moisturizing lotion to the skin. B. Cleanse the skin with soap and water. C. Avoid applying any products to the skin. D. Apply ice packs to the treated area. Answer: A. Apply moisturizing lotion to the skin. Rationale: radiation therapy can cause skin irritation. Applying moisturizing lotion helps soothe and protect the skin. Soap and water can be too harsh, and applying ice packs may cause additional irritation. Products should be used cautiously as directed by the healthcare provider. 141. A nurse is teaching a patient about cancer pain management. Which of the following statements by the patient indicates a need for further teaching? A. I should take my pain medications regularly to prevent pain. B. I can wait until the pain becomes severe before taking my pain medication. C. It is important to manage pain before it gets worse. D. Pain medications can be adjusted if I experience side effects. Answer: B. I can wait until the pain becomes severe before taking my pain medication. Rationale: pain management should be proactive to prevent pain from becoming severe. Waiting until the pain becomes severe may lead to poor pain control. Regular use of pain medications helps maintain consistent relief. Adjustments for side effects can be made, but waiting for severe pain is not an optimal strategy. 142. A nurse is caring for a patient with advanced cancer who is in the terminal stage. Which of the following should the nurse focus on in the care plan? A. Managing pain and providing comfort. B. Encouraging aggressive treatment to prolong life. C. Monitoring lab values for improvement. D. Offering nutritional supplements to increase weight. Answer: A. Managing pain and providing comfort. Rationale: in the terminal stage, the focus should be on comfort and quality of life, with pain management as a priority. Aggressive treatments and monitoring lab values are not typically helpful at this stage. Nutritional supplements are secondary to providing comfort. 143. A nurse is caring for a patient receiving chemotherapy for breast cancer. The patient reports feeling fatigued and weak. Which of the following should the nurse do first? A. Encourage frequent rest periods. B. Increase the patient's protein intake. C. Administer a dose of pain medication. D. Recommend an exercise regimen. Answer: A. Encourage frequent rest periods. Rationale: fatigue is a common side effect of chemotherapy. Encouraging rest is the first step in helping the patient manage the symptom. The other interventions may be helpful, but are secondary to addressing the immediate need for rest. 144. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient is at high risk for infection. Which of the following actions should the nurse take to prevent infection? A. Ensure that the patient is in a private room. B. Administer immunizations as prescribed. C. Allow the patient to have visitors freely. D. Monitor the patient's blood pressure regularly. Answer: A. Ensure that the patient is in a private room. Rationale: a private room helps prevent exposure to infections from other patients. Immunizations should be up to date, but are not a priority while the patient is undergoing chemotherapy. Visitors should be limited to reduce the risk of infection. Monitoring blood pressure is important, but does not directly address infection prevention. 145. A nurse is caring for a patient with cancer who is experiencing extreme pain. The nurse is preparing to administer an opioid analgesic. Which of the following should the nurse assess before administration? A. Pain intensity and level of sedation. B. The patient's blood glucose level. C. The patient's temperature. D. The patient's mobility status. Answer: A. Pain intensity and level of sedation. Rationale: Before administering an opioid analgesic, it is essential to assess pain intensity and the patient's level of sedation to ensure appropriate dosing. The patient's blood glucose, temperature, and mobility are important, but are not the most immediate concerns when managing pain. 146. A nurse is caring for a patient with terminal cancer. The patient asks about the expected outcome of treatment. Which response by the nurse is most appropriate? A. You will likely live for several more years. B. We are focusing on managing symptoms and improving quality of life. C. We will cure your cancer through treatment. D. You will need to decide if you want to continue treatment or stop. Answer. B. We are focusing on managing symptoms and improving quality of life. Rationale. In terminal cancer, the focus shifts to symptom management and comfort. Curing the cancer is not an expectation, and providing a clear and compassionate response is key to the patient's emotional well-being. 147. A nurse is providing care for a patient receiving radiation therapy for head and neck cancer. The patient complains of dry mouth and difficulty swallowing. Which of the following interventions should the nurse prioritize? A. Administer prescribed mouthwash. B. Increase fluid intake. C. Provide soft, moist foods. D. Encourage frequent oral care. Answer. C. Provide soft, moist foods. Rationale. Dry mouth, xerostomia, and difficulty swallowing, dysphagia, are common side effects of head and neck radiation therapy. Offering soft, moist foods makes swallowing easier and helps with comfort. While mouthwash, fluid intake, and oral care are important, they are secondary to improving the patient's ability to eat. 148. A nurse is teaching a patient with colorectal cancer about managing chemotherapy side effects. Which of the following should the nurse emphasize to reduce the risk of infection? A. Avoid large crowds and people with infections. B. Use a soft toothbrush to prevent gum injury. C. Wash hands frequently and avoid touching the face. D. Ensure adequate hydration and a high-fiber diet. Answer. C. Wash hands frequently and avoid touching the face. Rationale. Chemotherapy can weaken the immune system, increasing the risk of infection. Hand hygiene is the most effective way to prevent infections. Avoiding large crowds and using a soft toothbrush are also important, but do not directly address the prevention of infection as effectively as hand hygiene. 149. A nurse is caring for a patient with prostate cancer who is receiving hormone therapy. The patient reports hot flashes and mood swings. Which of the following is the most appropriate nursing intervention? A. Administer a medication to treat depression. B. Provide a fan or cool cloth to manage hot flashes. C. Suggest exercise as a way to manage mood swings. D. Encourage the patient to take antidepressants as prescribed. Answer. B. Provide a fan or cool cloth to manage hot flashes. Rationale. Hot flashes are a common side effect of hormone therapy for prostate cancer. Providing cooling measures such as a fan or cool cloth can help alleviate discomfort. While exercise and antidepressants may be helpful for mood swings, addressing hot flashes takes priority. 150. A nurse is teaching a patient with lung cancer about the side effects of chemotherapy. Which of the following should the nurse include in the teaching plan regarding the prevention of mucositis? A. Rinse the mouth with alcohol-based mouthwash. B. Brush teeth vigorously to remove food particles. C. Use a soft toothbrush and rinse with a saline solution. D. Avoid drinking fluids to reduce irritation. Answer. C. Use a soft toothbrush and rinse with a saline solution. Rationale. Mucositis is a common side effect of chemotherapy, and gentle oral care is essential. A soft toothbrush and saline mouth rinse can help prevent irritation and promote oral comfort. Alcohol-based mouthwash should be avoided, as it can further irritate the mucosa. 151. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. The patient is at risk for neutropenia. Which of the following precautions should the nurse implement to protect the patient from infection? A. Place the patient in a private room with reverse isolation. B. Restrict all visitors from the patient's room. C. Ensure that the patient receives a flu vaccine. D. Administer prophylactic antibiotics. Answer: A. Place the patient in a private room with reverse isolation. Rationale: neutropenia increases the risk of infection, so placing the patient in a private room with reverse isolation is essential to minimize exposure to pathogens. Visitors should be limited, but complete restriction is unnecessary. Prophylactic antibiotics are used selectively. 152. A nurse is providing care for a patient with metastatic breast cancer who is receiving chemotherapy. The patient reports nausea and vomiting. Which of the following actions should the nurse take first? A. Administer an antiemetic as prescribed. B. Assess the patient's hydration status. C. Offer small, frequent meals. D. Provide a cool cloth to reduce discomfort. Answer: A. Administer an antiemetic as prescribed. Rationale: nausea and vomiting are common side effects of chemotherapy. Administering an antiemetic as prescribed is the first step in managing these symptoms. The other interventions can be implemented after the immediate symptom relief is addressed. 153. A nurse is caring for a patient who is receiving radiation therapy for lung cancer. The patient asks about potential long-term side effects. Which of the following is a potential long-term effect of radiation therapy for lung cancer? A. Cataracts. B. Osteoporosis. C. Respiratory complications. D. Hearing loss. Answer: C. Respiratory complications. Rationale: respiratory complications, such as fibrosis, are common long-term effects of radiation therapy for lung cancer. Cataracts, osteoporosis, and hearing loss are potential side effects of other treatments, but are not as closely associated with radiation therapy for lung cancer. 154. A nurse is caring for a patient receiving chemotherapy who has developed thrombocytopenia. The nurse should instruct the patient to avoid which of the following activities? A. Walking and light exercise. B. Taking hot baths. C. Using a razor to shave. D. Eating a high-protein diet. Answer: C. Using a razor to shave. Rationale: thrombocytopenia increases the risk of bleeding, so using a razor to shave should be avoided to prevent cuts and bleeding. Walking and light exercise are generally safe unless contraindicated by the patient's condition. Taking hot baths does not directly relate to the risk of bleeding. 155. A nurse is educating a patient with breast cancer who is about to start chemotherapy. The nurse should teach the patient to report which of the following immediately? A. New or unusual headache. B. Pain or tenderness in the mouth. C. Increased appetite and weight gain. D. Mild joint pain. Answer: B. Pain or tenderness in the mouth. Rationale: chemotherapy can cause mucositis and increase the risk of infection in the mouth. Pain or tenderness in the mouth should be reported immediately to prevent complications. Headaches, appetite changes, and joint pain should also be monitored, but are less urgent. 156. A nurse is caring for a patient who is receiving radiation therapy for thyroid cancer. The patient is experiencing severe fatigue. Which of the following should the nurse recommend to the patient to manage this symptom? A. Engage in mild physical activity, such as walking. B. Increase intake of caffeine to boost energy levels. C. Take long naps during the day to rest. D. Reduce fluid intake to avoid the need for frequent bathroom trips. Answer: A. Engage in mild physical activity, such as walking. Rationale: mild physical activity can help combat fatigue and improve overall energy levels in patients receiving radiation therapy. Caffeine can disrupt sleep and is not recommended. Napping can help, but it should not interfere with regular sleep patterns. Fluid restriction is not appropriate unless medically indicated. 157. A nurse is caring for a patient who is receiving chemotherapy for colon cancer. The patient reports feeling lightheaded and dizzy. Which of the following is the nurse's priority action? A. Administer an antiemetic. B. Monitor the patient's blood pressure. C. Provide a calming environment. D. Encourage oral fluid intake. Answer: B. Monitor the patient's blood pressure. Rationale: lightheadedness and dizziness may indicate hypotension, which can be a side effect of chemotherapy or dehydration. Monitoring blood pressure is the priority action to assess and manage the symptom. The other actions may be appropriate later, but are not the immediate priority. 158. A nurse is caring for a patient with cervical cancer who is undergoing brachytherapy. The nurse should take which of the following precautions when caring for this patient? A. Wear a lead apron when providing direct patient care. B. Administer prescribed antiemetic medications before treatment. C. Limit the patient's fluid intake to prevent urinary retention. D. Maintain a sterile field when changing the dressing. Answer. A. Wear a lead apron when providing direct patient care. Rationale. Brachytherapy involves the placement of radioactive material inside the body, and the nurse should wear a lead apron to reduce exposure to radiation. Anti-nausea medication may be given before treatment, but it is not the main safety concern. Fluid intake should be encouraged unless contraindicated. 159. A nurse is caring for a patient with advanced cancer who is receiving palliative care. The nurse should prioritize which of the following interventions? A. Administering antibiotics to prevent infection. B. Controlling the patient's pain and symptoms. C. Encouraging the patient to eat a well-balanced diet. D. Providing curative treatments. Answer. B. Controlling the patient's pain and symptoms. Rationale. In palliative care, the primary focus is on providing relief from pain and symptoms to improve quality of life. Antibiotics and a well-balanced diet are important, but are not the priority at this stage. Curative treatments are not part of palliative care. 160. A nurse is providing care for a patient with end-stage cancer who is experiencing shortness of breath. The nurse should take which of the following actions first? A. Administer an opioid analgesic as prescribed. B. Place the patient in an upright position to ease breathing. C. Increase the oxygen flow rate as prescribed. D. Provide a calming environment to reduce anxiety. Answer. B. Place the patient in an upright position to ease breathing. Rationale. Placing the patient in an upright position is the first intervention to help alleviate shortness of breath. Oxygen, analgesics, and a calming environment may also be beneficial, but are secondary to improving the patient's ability to breathe.